Hello and good evening, you all. I am happy to have you here. Hope you're having a good Monday as well. And also, please let me know, as always, as usual, just so I know everything is working as it should and you can hear me well. Hi, Dr. Stepan. How are you today?
Hi, good evening. Very well. How are you?
I'm all good. Thanks for confirming that you can hear me as well. It's a pleasure to have you here. And just let me quickly remind you why we are here gathering every single day from Monday to Friday, as you already know that. But just wanted to again tell you that Stronger Together initiative has been created for all of our patients that are struggling at this point where they cannot go ahead with their treatments or just needed to stop their treatment simply because nowadays, because of COVID-19, it's just not possible to do it. But this is your time for to find out as much as you can on your treatment options, but also meet the experts from the IVF field. But and also, this is also opportunity for you to join and get connected with other patients that are exactly at the same point as you are. So hope I am happy to see you every day and know that you are able to take part in it as well. And of course, it wouldn't be possible if it weren't for our ambassadors and partners. You can see all of them right here on the screen right now. So, of course, as I mentioned, without them, wouldn't be happening. So definitely some of them you might already know. They have been having some webinars. They will be having some webinars, and of course patient meetings. And now today, I would like you to introduce Dr. Stepan Karabinyosh, who is actually infectious disease specialist at Medicover, which is located in Ukraine. And he will, of course, talk about infectious diseases and IVF. Hi, Dr. Stepan, one more time.
Hi.
Hi. All right.
Thank you so much.
Fantastic as I mentioned, fantastic to have you here. Thanks for joining our initiative as well. And I guess that will be it from me. Remember to type in all of your questions in the chat section, and Dr. Stepan will simply answer them one by one as well. And now I guess that is it's time to start our very of our topic right now. Sorry, Dr. Stepan, are you ready?
Yep, I'm here. Yeah, I'm
Perfect.
ready.
Go ahead.
So, if you don't mind, I'd like to start with introducing myself. First of all, my name is Dr. Stepan Karabinyosh, and I'm an infectious diseases specialist of Medicover Intersona, which is located in Uzhhorod, Ukraine. Well, I've recently got my second specialty, which is pediatrics. So, kind of broaden a little bit my field. So today, well, I chose to talk a bit on infectious diseases and IVF. Of course, the topic number one that is everywhere right now is the coronavirus. However, I do want to emphasize a bit on other infectious diseases which are not related to coronavirus, because they actually do have their importance and they still remain online as I can say. So yeah, a few things about coronavirus that I really wanted to add is, of course, that ESHRE actually recommendations were that we actually hold on a bit on the IVF treatment for the period of the coronavirus COVID-19 outbreak. So, of course, that's an unfortunate news, but on the other hand, it's a good news for those people who actually need some more information. So, I'm very happy and I'm honored to be here today and to share a bit of my knowledge with you, as well as to be part of the team Stronger Together who can actually bring this for you. So we can start, I guess. Hello?
Sorry, I am right,
Hello?
of course. So we can start with our common questions, correct?
Mm-hmm. Yeah,
Perfect.
let's go for it.
So we will definitely start with most common questions from patients, and right after that, we will go to your questions as well. So let me go to the very first one. Which infectious diseases can lead to infertility?
Yeah, that's a common question that usually patients come to us with. Well, first of all, we need to define what are the infectious diseases, and those are the diseases that are communicable, the diseases that can spread from one person to another. So, of course, sexually transmitted diseases, the STDs, they're number one diseases that may lead to infertility. We also need to keep in mind that usually that's the diseases that are caused by viruses, bacteria, by fungi, and as well, there's a group of diseases which is still not really defined by the scientist whether there's a bacteria or something else. So those are the intracellular parasites such as mycoplasma and uroplasma and chlamydia. I think that most of our listeners today and viewers today, they've heard it before. These diseases, of course, may lead to infertility. So a few things that we also need to understand: how does that happen? Usually the diseases that are caused by the intracellular parasites, those are the ones that are causing the difficulty in the passage of either the embryo or the sperm in order to fertilize. So, of course, for instance, chlamydia or uroplasma, they might be either affecting the passage in the ovarian tubes or maybe in the canals that the sperm is moving out. So those are the main causes of female and male infertility caused by the intracellular parasites. The viruses, on the other hand, that's something that I would actually emphasize on, and that's why usually the couples that are reaching doctors for planning the pregnancy, they are being tested for the herpes viruses family. And previously, the testing was quite limited. It was mainly limited to rubella virus. It was limited to herpes labialis and herpes zoster, because herpes family actually has 8 types. It's a huge family of viruses. So right now we've realized that the cases of the endometriosis, viral endometriosis, is mainly caused by CMV virus or sometimes by Epstein-Barr. And maybe you've heard of Epstein-Barr virus or EBV. That's the virus. Well, we also call it kissing disease that transmits through saliva, and people can easily contract it from using the utensils or using the glasses. So that's why that's some field that is actually bringing more and more attention right now of the infectious diseases doctors. And of course, a lot of bacterial infections, I would say probably more of a chronic diseases of the UTI, of the urinary tract. They might affect the fertility functions. And then somebody, yeah, I can see a question: how does infections influence the quality of sperm? So there is evidence, and it's already been confirmed by various studies, that viral infections can necessarily affect the mobility, the motility of the sperm. So of course it can get weakened. So one of the from my own experience, one of the most common causes of the sperm ineffectiveness, the sperm immotility, that is the hepatitis B virus. It's a quite common cause around the population here.
Mm-hmm. Thank you so much for explaining this very first question. And thank you for answering already the other question as well. And now go to the next one. What is the role of the germs when how do they protect us?
That's a very amazing question, to be honest, because, well, I probably knew that I'm going to choose infectious diseases from the get-go when I just joined medical school. The world of germs is amazing. It's a totally separate universe, and unfortunately, we know very less about it. And we are probably just one step in this huge field. So I really love the study which was performed. If I'm not mistaken, it was in the United States of America in Florida. So there has been a study where they've studied the normal microflora of the pregnant women. So as you know, of course, women have a special microflora in the vagina that provides a special the environment there, and it is very crucial for the hygiene purposes, for the women health, and of course for the reproduction. We all know and we've heard before the word of Lactobacillus subtilis. So lactobacteria, it's an amazing process of how the nature has made an agreement with female body, because the mucosa of the uterus of the vagina, produces starch. Well, it's called volutin, and that starch, it's some kind of food for lactobacteria. So and that process is required for maintaining the natural barrier against the bad bacteria, which, of course, the genitals, the inner reproductive organs are exposed to if there is no barrier. So the acidic environment of vagina and the presence of lactobacteria, that's basically the first line defense. And the reason why I'm bringing up this topic right now, because this bacteria as well then inseminates, it spreads around the pregnant female's body, the future mom's body. And then once the baby goes through the labor, the baby also gets this bacteria on its body, and then eventually it's protected from the surrounding bad bacteria. That's just one of the examples, because we also do have an example of other bacteria that help us to digest food, for example. We have a bacteria that a lot of people heard, and I think that probably those that are listening to us right now, they've heard it before. It's called E. coli, Escherichia coli. And usually, well, I also teach at the university, so I usually give this kind of well, it's a riddle to the students that colon and coli produces vitamin K, and vitamin K is crucial and essential against bleeding. So, of course, adults, we do have this bacteria throughout the life. However, kids still they are in need of vitamin K. So this is how nature basically provides us with the required essential things. And it's interesting how we learned how our body, without even us knowing it, learned how to use the bacteria around to protect ourselves from infectious diseases. Same thing, it's also related to contracting diseases, including coronavirus, because if you, well, of course, there's a certain procedures which we need to maintain, and that's the social distance. That's also maintaining the certain hygiene, etc. But however, the presence of good microflora protects us from contracting diseases as well. So that's basically how the microflora works and how it can protect us from the bad germs. The good example as well is Streptococcus epidermidis, that our skin is covered with. So that's why we also need to remember that inasmuch we really need to use the soap and constantly remember about hygiene and sanitizers, we also need to nurture and we need to apply moisturizers for the skin, unless because we expose ourselves to the bacteria as well. Besides, I'll give you an example. I've recently read on Facebook, there was a complaint from one of the mothers that she brought her child to the store, and right now all the stores, they have sanitizers. So the child used the alcohol-based sanitizer, and there was a huge rash all over the skin. And then he was complaining why the store is using the sanitizer. It's not about the sanitizer, it's about nurturing the skin after you clean it properly. So we also need to remember that. So germs, their role, how they can protect us. Well, it's like an example of people who can settle certain land and they build their civilization there. So the other people, they simply can't come because the area is already occupied. That's an example of how the good germs can protect us from the bad germs.
Fantastic. Thank you so much for sharing all the information. It seems that we could do another IVF webinar only about, even germs. So yeah, thanks so much for
Sure.
that. And now let me go to the next question here. What to do if one of the partners has HIV or hepatitis?
Yeah. So if we're talking about, because we need to also understand different periods of pregnancy. If we're talking about pre-pregnancy, the IVF, that's one question. And then if the conception has already occurred, if the fertilization has already occurred. So let's talk about HIV first. If the female is already pregnant and is HIV positive, then usually we follow the protocol on how to maintain the HIV positive pregnancy. However, if it's HIV, let's say, in one of the partners and they're still planning the pregnancy, that's a totally different story. There's something we can do about men, and then there's something we can't do, unfortunately, about women. And I think, well, I'll talk about this specifically. Now, hepatitis, it depends which kind of hepatitis, because we remember that there are two types of the parenteral hepatitis. Basically, that's the hepatitis B and C. They can be either sexually transmitted, they can be transmitted during the cosmetic procedures or dentistry. So far, from my own experience, probably dentistry and poor sterilization of the equipment, it's one of the most common causes of hepatitis B and C among patients. So basically, hepatitis is not a bad diagnosis. We can still manage IVF. HIV, that's depending on which partner is infected. Hello? Can you hear me?
Me? Hi, can you hear me?
Yeah.
Oh, okay. I was worried for a second, but all is good. Yes, we will get to that with the next question, actually, right? So what if mother gets infected with hepatitis during pregnancy?
Yeah. Now, if the hepatitis was contracted during pregnancy, usually that's, well, infected, from being infected to developing the actual disease, we still have some time, because usually the incubation period of hepatitis C may be up to several months. Hepatitis B is usually up to 1 month. And then we have the period of acute hepatitis. And this really depends on the person itself. It's not really specific, because everyone has different course of the disease. So usually acute hepatitis, if it is, there's no treatment whatsoever for acute hepatitis, unfortunately. What we do is only supervision of the patient, and usually this patient has to be supervised by infectious diseases and gynecologist. And afterwards, there are certain things that we need to do. For instance, if that is hepatitis B, then of course we have to vaccinate the child, the newborn, within the first 12 hours after birth. If that's hepatitis B, then C, then we have certain tests we need to do in order to find out what is the genotype of the virus and what treatment we can provide. Besides, well, I can see that there are a lot of patients, a lot of questions on hepatitis. What I would advise, before you even plan the pregnancy, that's very important. You need to check your data, whether you've been vaccinated for hepatitis B before. If not, I would advise you to actually do get vaccinated. Hepatitis B vaccine, no matter what is the producer who actually manufactures the vaccine, it's genetically created. So basically, you don't have any inflammatory process. You don't have the disease itself, which means there's no complication. And hepatitis B protects you for entire life. The vaccine protects you for entire life. And a very important point is there's no treatment for hepatitis B. We do prescribe sometimes according to the EASL, the European Association of Liver Diseases, we prescribe the interferons. That's something that helps the immune system to attack the virus as well as attack the liver, which is totally contraindicated in pregnancy. So that's why the only treatment during pregnancy, that's supportive treatment. We give sometimes IV solutions in order to reduce the intoxication, and basically that's the supervision. And then after pregnancy, we of course decide what would be the treatment plan for the mother.
And thank you again for explaining this very important topic again, and of course answering in detail. So let me go to the next question. Why there are not so many IVF clinics treating HIV positive patients?
Yeah, that's a very good question. It's more ethical, I'd say. Unfortunately, historically wise and mentally wise, a lot of countries still we consider HIV as something very bad. It is bad. It is definitely bad. However, we learned how to manage the disease, how to maintain the good health of patients and the good long life expectancy. So, unfortunately, patients, as I said before, it's an ethical issue. So, patients who are totally healthy, they don't want any of their biological material be anywhere close to the possibly contaminated, of course. And therefore, not many clinics, they have outsourced labs where they can actually process the material. For example, here in Uzhgorod, the clinic where I work at, we have an agreement with the HIV Center, the clinic which specifically works with HIV/AIDS patients, and they have their own lab where they provide the services for us. So they do the sperm washing, they do the testing, they also provide the testing of the patients. So that's why it's very budget consumptive, and of course it requires a lot of facilities and staff working. So not many clinics, they can afford that, number one, and number two, not all of them have access to the specific labs. So that's probably one of the main reasons.
Up then for us, of course, as well. It's definitely a very important question, and I'm sure many patients are finding this really, really useful. So thank you again. Let me go to the next question. What would you recommend IVF treatment options for a couple where a woman is HIV positive? What is the risk of passing the HIV onto a child?
Yeah. So number one, what I would offer as a specialist, I would probably go for surrogates and also egg donation, because there is quite strong evidence that ovus, the eggs, they might be contaminated. And that's why you can do sperm washing, which is quite easy. But then for the eggs, it's way different. So that's why I would say that number one option would be donation and the surrogate. The risk, of course, the vertical transmission is quite high. Yes, we've learned that the antiretroviral treatment may avoid the transmission. However, the risks are still high, and there's no probably it's not that easy to give any guarantee to the patient. So that's why most of the times we would prefer to take this off.
Okay, thank you. Thank you so much for explaining that to us as well.
Sure.
And so, what would you recommend for a couple where the partner male is HIV positive? What is the risk of passing the HIV on to a child? You have mentioned this, of course, already, but can you comment on that as well?
Yes. So the recommendations for the HIV positive, for the males, that we will do the sperm washing, and then of course there's going to be the PCR testing, and only in case of the PCR negative results we would advise the conception. But then again, in all of these cases, it should be strongly, the communication has to be really, the doctor really needs to communicate all of these things to the couples, and have the strong understanding from the patients. So the options would be the sperm washing, fertilization in case of HIV negative female, of course.
Of course. Thank you so much.
Mhm.
And here's the next question. Quite similar, but let's take a look. What would you recommend for a couple where both partners are HIV positive? So, what is the risk of passing the HIV onto a child? Then again.
Well, again, it's probably the same answer as we have to the question number one. We can do the sperm washing, and then we could recommend surrogacy.
Okay, perfect. Thank you for summing that up as well. And now, here's the next question: acute respiratory or intestinal infections during pregnancy. Would the disease or treatment hurt the child?
It's a very good question, actually, a very good one. So, in as much the pharmaceutical business and pharmaceutical companies are trying to produce as much as possible the safe medications, however, they still do have an effect. Probably not as much as on the child itself, the fetus, but then it may affect the health of the mother. So, therefore, it's always good to protect yourself before you actually plan the pregnancy. So in this case, I would say it's good to be vaccinated before getting pregnant, which is very important. And it's also very good to have a look on the vaccines that you've got before. So we have here a question I can see. What about vaccination during pregnancy, rubella? So rubella itself, it's not indicated. Even the varicella zoster, the chickenpox, we're more common with this name. So it's always better to get vaccinated before you get pregnant itself, because there are a lot of complications from the disease itself. So respiratory diseases, we're actually facing a huge pandemic outbreak of one of those right now. Unfortunately, there's no vaccine. There's no way we can protect ourselves at this stage. But yes, it's always better to protect yourself with the vaccination. I can see one more question here. Is there any information about how does COVID-19 influence the pregnancy? So an interesting, well, I've been, of course, when you're infectious diseases, you are forced to constantly monitor all these things. So yes, there's no evidence, there's no clear evidence whether COVID-19 can actually go vertically from mother to child. There were cases registered, as well as I actually have right next to me the report of ISHRI News, the statements report, posted on the 2nd of April. And they clearly state here that there's no evidence between the vertical transmission from mother to child. However, there were cases, so we can't really exclude it for now. Well, what I can say is the treatment which is prescribed in COVID-19, even though currently it's non-evidence-based and it's not really scientific, it's more empirical approach, such as the anti-malarial drugs which they're using and hard antibiotics that could definitely influence the fetus. So in this case, the treatment itself has more impact rather than the virus.
Thank you so much for already answering that question from the patients. Of course, please, we will start with your other questions soon. So get ready and type them all in. Okay, we will have the last question of those most common questions asked, and it will be the rest of your questions, of course. So here's the question: how to avoid infectious diseases being an IVF patient?
Well, as I said before, number one, of course, that's first of all, maintaining good hygiene. And, what's interesting, the things that are recommended by the World Health Organization, according to them, how to avoid COVID-19. There's a very, very simple things which we forgot about. That's the personal hygiene, hands washing, and also wearing a mask in the crowds and social distance. Those simple things definitely help you to avoid infectious diseases, being an IVF patient. What we need to understand is the IVF patient is the patient who goes through a series of hormonal changes. And pregnancy itself is an immunosuppressive state, meaning that immune system goes down a bit. So that's why we need to make sure that we are protected. And that doesn't mean that you have to wear the scuba diving suit. That simply means that you just need to be aware that there are certain things that you need to remember, and that's the hands washing. And once you return home, probably you might want to change your clothes, you might want to wash your face, those simple things. And it really helps to avoid a lot of diseases that can be contracted from the environment.
Okay. Thank you so much for answering those most common questions, of course, and also already answering some of them, some of the patients' questions, which I would like to show, even though I guess we have discussed that already. Yes, so we already, you answered already this question. Anything you would like to add to it by any chance, or?
Yeah, well, I just can say that mainly the viruses, that's the main common cause that changes the quality of sperm. However, also the chronic diseases of the UTI can have an impact on that. So basically, maintaining the good men's health and men's hygiene can help avoid a lot of things.
Perfect. Thank you so much. You already have answered. I just want to show those questions that we had. So what about vaccination during pregnancy? You already also mentioned that. And we also had a question about COVID-19, whether it's influencing the pregnancy. As of now, at least, it's not actually yet searched. Yes, and it's just like no proof, I guess, yet.
Yeah.
Okay. Perfect. Thank you for clarifying this. And we have the next question for you. Okay. So let me show you this one. What's your take on anti-malaria such as hydrochloroquine to treat
Hydrochloroquine. Mm-hmm.
Yes, thank you. To treat coronavirus. And second, does it affect pregnancy? You have already mentioned, but if there are any other comments on that.
Yes. So hydroxychloroquine is actually that empirical treatment. There's no evidence that it actually helps. Well, there is some relation. People actually do think that. Well, some of the doctors they do see some impact. What it does, let me try to explain probably what's the effect of it. It's not really that it's antiviral. It actually helps to reduce the immune response. So basically, what it does is when the immune system is attacking your own body during the pneumonia, COVID-19 pneumonia, what it does, it actually reduces that inflammatory response and kind of calms down the immune system. Of course, it does have effects on pregnancy, and then it depends because there's various data, and then currently it is not recommended to use in pregnancy. That's well. Here's the thing: it's the effect is not really that well studied, so that's why it's all about the risk.
Perfect. So everything seems that it's still like, it's had to be searched. There's no yes or no answer yet. Yeah. Thank you. And let's
there's no answer yet. What I can say is, by the way, it's very important also to remember that, and it's actually very important for those who are planning IVF in future. People who patients who were taking hydroxychloroquine due to coronavirus or whatever it is, they might the pregnancy itself could be it would be harder to get pregnant if I'm communicating this. So basically, you need to make sure that it's enough time after you actually consuming this medication, and that is usually 1 to 3 months. So what would be a good thing is to actually consult with infectious diseases doctor and with a gynecologist whether it's time to continue.
All right, fantastic. Thank you so much for that advice as well. And there's another question for you right here. Do you think COVID may affect an embryo implantation in any way? I'm in the situation when patient has an embryo transfer and she is a carrier and doesn't know. Thank you for that question as well.
She's a carrier and doesn't know. Well, if the person is a carrier, the person will know very soon, because what we know so far is it does manifest even with the slightest symptoms. Again, I might repeat myself. There's no strong evidence that this virus is transmitted through placenta through vertical transmission. So therefore, the implantation, yeah, right? The question was implantation. There's no evidence on that. So just taking the responsibility on myself, I might say that any viral disease causes immune response, which is inflammation, and inflammation usually results in the elevation of fever, and it might cause problems with implementation because the environment where implementation should occur changes.
Okay, thank you again for answering this question. And there's one more question. So can infectious diseases possibly lead to miscarriages?
Of course. We know that rubella may cause miscarriages. We know that several diseases, such as, for instance, Well, it depends again on the reactivity of the body, because even chickenpox sometimes may lead to miscarriages. Measles on early stages can lead to miscarriages. So, a lot of viral diseases, of course, they may lead to miscarriages. On early stages, not necessarily due to the fact of the infectious disease, but the response of the body. Let's say salmonellosis, that's the diarrheal disease, not because of the bacteria itself, but because of the diarrhea. It may lead to miscarriage. So, of course, infectious diseases, they have a huge role in pregnancy.
Okay, thank you so much for answering this also important question for many patients of ours, I am sure. And now we need to wait a bit because I do see someone is typing. So I guess that is the question. So let's give it a minute and see it right here.
Sure.
And
Well, in the meantime, while we're waiting for the question, what I wanted to say is, if you have a good connection with your doctor, it's always good that you always consult regarding the epidemic situation in the region. It's always important that you are aware of which diseases are around you and how you can protect yourself from them. For example, right now, and I'm actually very happy that we have quarantine and we have less people roaming around in woods.
okay.
This area where we live, we have in the woods, of course, we have ticks. So people are prone of getting Lyme disease contracted by ticks. So it's always important that you know what to expect in which environment. Of course, it's treatable. There is treatment and almost for everything, but then you have to be sure that you know how to protect yourself from things. It doesn't have to be. It doesn't have to be panicking, like, so that you're scared that the whole world is against you. But then still, you need to know how you can protect yourself and your child.
Yeah, it's definitely better to be cautious, right? And just be
Yeah.
aware of
Yeah.
what's going on for sure. All right. And I believe we have another
True.
question
True.
coming. So let me put it right here. So what influences oocyte quality more, HIV or antiviral drugs?
What influences oocyte quality more, HIV or antiviral drugs? Well, probably I would say that it depends. Again, it depends on which antiviral treatment is prescribed, because we do know cases of countries that have a humongous number of HIV positive people, and well, let's say Southern Africa. There are a lot of people that have HIV, but we do have evidence of HIV negative children because their parents were on the antiretroviral treatment. The quality, of course, would be probably reduced due to the virus itself, because we do have evidence that the virus can reach inside the ovum and influence that. That's a good question, actually. That's a really good question. And it also depends on the treatment availability, because we do have treatment options which help HIV positive couples, when both parents are HIV positive, have a baby without HIV itself.
Okay, thank you so much for your questions for sure and helping out as well. And now let's have a look at the next question, which is quite a longer one. Here it is. I was taking hydroxychloroquine, a few months ago to bring down inflammation. Are you suggesting that I should stop it 3 months before trying to get pregnant? I thought the point was to try to suppress my immune system so that the embryo would be less likely to be rejected and more likely to implant.
Yes, very well. Hydroxychloroquine, as I said before, it's not just the TNF. It doesn't just reduce the TNF. It also reduces the interleukins. And basically, for the COVID-19, we reduce the interleukin 4 and 6 in specific. But then it depends. Probably in your case, the indication was because the immune system was too aggressive, and probably that was the reason why the medication was prescribed. In this case, it's always important for you to consult the doctor and see the figures which you have right now and how good is your immune system. Because that's actually a good question, because you need to make sure that it's not too low enough, but then it's low enough for you to have implantation. I would advise you, first of all, to have a consultation with your doctor and see where you are with the TNF alpha right now, and then pursue. That would be my it's difficult for me to actually discuss your case right now without seeing any papers and any labs you've previously done and seeing your situation in specific.
Okay, thank you so much still for that advice. And also, I just wanted to remind you that, of course, if you would like to get in touch with Dr. Stepan, of course, and his team, you can also look at this link I have sent right now. And of course, this our online patient meeting, this one is recorded, so that means it will be available on that website, and you will be able to get in touch with him if you wish to get some more answers or have some other details that you would like to share, etc. You should definitely feel free to do so. So definitely this is something we can do. We will be slowly finishing, so if you have any questions, go ahead and type them all in, so you will not miss your chance to get an answer from the doctor right now. There is another question right here as well, so let me go to it now. I heard that my nearest hospital has infected patients. I'm pregnant. Should I travel to other hospital when the time comes? Thank you for that question.
You mean the COVID-19 patients, I assume?
Yes, I would as well. But
probably. So here's what I can say. Traveling itself may actually endanger you and the child as well. So I'm pretty sure that the hospital that you're planning to deliver at has the facility which is dedicated to the infected patients, and of course the facilities that are indicated for non-infected patients. And that is very important, because that was one of the main recommendations of the World Health Organization, to redirect the flows of the healthy and potentially sick patients. So probably I wouldn't, well, again, that's my opinion, right? I wouldn't really advise you to go for a different hospital if you are, if you feel safe and you feel fine with this one. One thing that probably you need to keep in mind is your delivery itself, unless it's cesarean, your delivery itself, if it's natural, it's crucial if you feel safe. The whole delivery itself will depend on how safe you feel. So if you think that this particular environment is safe and you feel fine here, then probably you should go with this one.
And fantastic. Thank you so much for answering that question and for your advice. It's definitely important. So thanks again. I do see someone is typing, so let's give it a minute, of course. As I mentioned, it is your final call for the questions. So go ahead if you have and type them all in. And also let me remind you that you will have still a chance to rewatch it tomorrow, probably tomorrow. Sorry, we are definitely will be working on that, and we'll be uploading the video very soon on our site. And also in the meantime, I just wanted to remind you that we will have another IVF webinar actually tonight at 8 p.m. UK time. So I hope to see you all there as well. And now let me have a look. It doesn't seem we have any more questions at this point, so I guess we will be finishing. So let me start with thanking you, Dr. Stepan, for joining our Stronger Together initiative, for your time and for, of course, your advice and all the details you have provided. It has been very useful, I am sure, an interesting topic
It's my pleasure.
well for so many of us. There are already some shout outs right here, so I'm not the only one who who is thankful and find it also happy to hear that. Thank you. It was super helpful. Happy to know that. There's another one right here. So let me show you this one. Here it is. Thank you for
Thank you. That's nice.
watching. Thank you so much. Okay, this is again interesting, very articulate and knowledgeable doctor. So
Oh, thank you.
it's really nice that you are here with us for sure. And there are even more thank yous, as you can see. happy to happy to do that with you tonight for sure as well. Okay, thank you so much. And I
Thank you.
just
It was my
wanted
great
to
pleasure.
also remind you that you can find all of our online patient meetings as well as IVF webinars on our website myivfanswers.com. You can also follow us on our Facebook channel, but also our YouTube channel, and you will be up to date with all the events. Let me remind you, those events we are having twice a day, starting from Monday till Friday. So as you know, we will have one more coming at 8 p.m. tonight, and again we'll be here tomorrow at 6 p.m. and so on and so on. So happy to have you all here again, Dr. Stepan. Thanks so much. Huge thank
Thank
you.
you.
Is there anything else you would like to add?
Well, I just like to add you, please stay safe. Please take care of yourselves and your loved ones, and everything will be all right. We're soon going to be happily enjoying our coming spring. So please go for your dreams, and they will definitely come true. Thank you
Perfect.
again for having me. It was my great pleasure.
Definitely, same here. And that was a great summary for for tonight, because this is in this time. Stay safe, you all, and hope to see you very very soon. Thank you so much. Bye.
Thank you. Bye.